Hello, Dr. Mark Dailey here. Up to this point, we discussed the origin and discovery of subclinical gluten intolerance as well as its similarities with celiac disease. We mentioned that celiac disease is not subclinical because the symptoms are so very obvious. In many people, however, who suffer from gluten sensitivity, the symptoms are called subclinical because they're really not easy for the clinician or the patient to isolate. We also distinguish gluten and gliadin, which is the actual polypeptide that causes the subclinical reactions. We talked about soy and the possible reaction that those who have gluten sensitivity may have to soy as well. So following what we're going to do now is talk about the physiological effects of subclinical gluten intolerance. And following some of the physiological changes that result from some subclinical gluten intolerance. In those with subclinical gluten intolerance, gliadin causes mucotoxic inflammatory reactions as it comes in contact with the wall of the small intestines. This reaction usually goes unnoticed at first. In fact, this low-grade inflammation may go undetected for years, even decades, before it results in the expression of symptoms. The ultimate effect of this hidden wear and tear is the slow destruction of the healthy mucosal lining and the tissues of the small intestines. In some cases, there may be symptoms in childhood, such as allergies, asthma, recurring infections, a constant upset stomach, or milk intolerance. Often these symptoms fade in the early adult years, only for the problem to reappear when a person is between 35 and 55 years of age. Inflammation comes from the Latin root inflammare, which means as to set on fire or to flame within. This setting on fire is a literal description of the actual destructive process gluten initiates. Inflammation is your body's way of reacting to injury. When exposure to gliadin, when exposed to gliadin, the inflamed intestines undergoes significant structural changes. Inflammation is a familiar experience to everyone. For example, the reaction of the sinuses during a bad cold or flu is an inflammatory reaction. Other examples of inflammation are from the responses to physical trauma, like pain from low back injuries or from hitting your thumb with a hammer. In all these situations, the inflammatory response is activated. This response is the body's attempt to repair tissue damage and prevent infections by quickly bringing our own response team to the injury site. This physiological protection includes the immediate activation of a complex system that takes place regardless of the initial source of inflammation. The purpose of this physiological mechanism is to handle the insult, whether it's physical trauma, a viral or bacterial infection, or the gliadin molecule in those who are gliadin or gluten sensitive. In each case, the body attempts to remove the harmful substance and quickly control the damage that's been caused. With a mucotoxic reaction to gluten in the gastrointestinal tract, initially there will be heat, redness, swelling, and importantly, change or interruption in the normal function of the small intestines. On the cellular level, a series of events take place, including dilation or enlargement of blood vessels with increased permeability and blood flow. This brings more blood to the site of injury to provide greater protection in the form of white blood cells and other immune system cells. There's also an exudate or leaking of fluids from the blood vessels into the tissues with an accompanying swelling. 12 to 14 hours after this series of physiological reactions, the body's response to gliadin fades, provided there's no further exposure. At this point, the physical regeneration and repair process can begin. Now, if you eat gluten, again, the gliadin exposure is repeated. And there's no let-up in the inflammatory cascade, and the damage to the lining of the small intestines just continues again and again. This inflammatory reaction goes largely unnoticed simply because it's not severe enough to cause immediate symptoms. If a gluten-intolerant person eats gluten-containing foods for extended periods of time, over and over again, the low-grade inflammation can lead to a variety of much more significant problems. With long-term exposure, the result of this low-grade response to the gluten or gliadin molecule can be devastating to a variety of body symptoms or body systems. Its effect on the digestive system is the most immediate.